Hello and welcome back to the Clinic Minute. I'm Dr. Brown and this month's topic is reserved for men's health. It's obviously a broad topic, but I thought I'd first start with recommended screening tests, review heart health, and then cover basics around testosterone deficiency. Let me start with some of the screening tests available. The prostate blood test to screen for cancer is called prostate-specific antigen, or PSA, and is recommended for men aged 50 and older. But we start the test much sooner for those with a family history of prostate cancer or other risk factors. Screening for colon cancer is now recommended at age 45, down from the previous recommendation of 50. But oftentimes, like these other tests, we have to have it done sooner. For a long time, the gold standard was colonoscopy, and that remains the case for many. But other screening options exist for colon cancer, like doing the Cologuard stool test every 1 to 3 years. And then even more options exist for older patients with underlying problems making colonoscopy too risky. Now for heart or cardiovascular health, we screen for high blood pressure or hypertension with nearly every visit to the doctor's office. But the United States Preventative Services Task Force, or USPSTF, recommends doing so every year after 40. Cholesterol screening should ideally be done when we are young adults and repeated yearly when we are into our 30s and 40s. We screen at-risk patients for diabetes, including those with family history and those diagnosed with high blood pressure. Diabetes is a risk factor for heart disease. Obviously, smoking is a risk factor for heart disease too. Smokers may be eligible for a CT lung screening to assess for nodules and cancer at age 50. Your doctor's office can assist by seeing if you fit the criteria for age, years smoked, and packs smoked. Men who have smoked, now aged 65 to 75, should undergo an ultrasound to look for aneurysms of the aorta, called AAA. Not everyone takes a baby aspirin anymore. The decision to take a baby aspirin for the primary prevention of cardiovascular disease is made on an individual basis with your provider. Those at risk for heart disease can undergo coronary artery calcium testing with a CT heart score. These scores help us determine if we should use certain medications, do additional testing for the heart, and make lifestyle modifications. Another important test for symptomatic individuals is a sleep study. It can be hard to lose weight and feel energized, not to mention it's hard on the heart when we stop breathing and oxygen levels go down during sleep. I love to order CT heart scores and home sleep studies in many patients. It is something you can easily talk to your provider about. And now for testosterone deficiency. Men experiencing low energy and low libido may need to be tested. Findings of low testosterone may include small testes, decreased facial or body hair, decreased muscle mass, something called gynecomastia or breast tissue enlargement, or infertility. Low T can be caused by many conditions, so it is best to have a good primary or endocrinologist work it up appropriately so that the rare causes are caught. And hormone values naturally fluctuate, so your provider will want to confirm the low values with repeat testing prior to treatment if your test comes back on the low end. Potential adverse effects of testosterone treatment also must be considered. We do prostate cancer screening. Watch for benign prostatic hypertrophy, or BPH, because it can cause urinary outflow issues, and watch for changes to the blood and risk for something called venous thromboembolism, or clots. And there is a possibility in some men of increased heart risk, and manufacturers have clarified their labeling to reflect the possible increased risk of heart attacks and strokes. So, as you could see, I could go on and on about the recommended screening test and issues pertaining to men. Even just doing a simple yearly check-in with your doctor can facilitate these conversations and make some of the difficult issues more easy to discuss. Until next month, everyone, stay well.